52%. 52% of the physicians surveyed indicated that the relationship between themselves and the hospital management or administration was somewhat or mostly negative. Physicians probably carry the perception that management and administration, quote unquote, live in their ivory towers and do not adequately understand bedside dynamics. That management is mainly interested in pursuing financial goals at the expense of patient and physician safety or satisfaction. Unsurprisingly, management may privately hold the view that doctors don't adequately understand the economic nuances and challenges of running a complex hospital business. Both perceptions have merit. How often has a CEO or a CFO entered or spent time within the OR, the operating room, or at the OPD? Conversely, how often have doctors participated in meetings around budgeting and governance? Alienation between management and physicians is a reality. And this is a reality that is present across hospitals and across geographies. 52 to 70%. 52 to 70% of doctors, depending on geographies, are part of the employed model, not the independent practitioner model. Many large private hospitals are funded, owned, and or run by non-medical professionals. They are measured, obviously, by and naturally inclined to attend to financial outcomes, and this is understandable. It is also the fiduciary responsibility of the boards to fulfill the just financial demands of the investors and shareholders in return for their investments and for their risks. Doctors must rethink the dilemma and might have no choice but to become more actively involved in leadership and positively influence hospital economics as they maintain the delicate balance with patient and physician safety. I think it's also true that doctors may not have been asked to lead or even felt the need to be a frontline leader. They probably never fancied themselves as leaders. But I think all this changed during COVID-19 when doctors came on the front line and led from the front. Today, hospital services focus mostly on operational metrics. If you look at the balance scorecard or the KPIs, they are mostly metrics like wait times, delays, resource utilization rates, intervention rates. Management's focus of hospitals is on the transactions of care delivery. However, as the focus in healthcare systems increasingly shifts to value and outcomes in healthcare delivery, clinical leadership becomes more important and hence more reason for doctors to take center stage. I suspect that doctors unwilling or uninspired to lead organization focused solely on the efficiency of resource allocation may be more willing to take on an active leadership role in those hospitals that are focused on clinical outcomes and value-based care. On to the final survey result, which is the saddest of them all. 70% doctors won't recommend medicine as a career option to their children. This number is increasing. Amongst all the survey results, this last trend especially caught my attention. It singularly gives us a vivid description of the mindset of today's doctors. Their lives are not easy. As recipients of medical service, we must also contribute positively so that the atomic and sacred interaction between us as patients and our doctors is meaningful and enriching. I suspect that the issue in referring to medical practice as a calling and giving it a religious spin might be more harmful for both doctors and patients in the final analysis. Doctors, like any of us, need a healthy work life balance. It just might be better to treat it like another job, a critical one, no doubt, but not add the psychological stress and pressure that comes with making it sound evangelical.